Hi guys! Today I'm going to be talking a little bit about OCD. What is OCD? How would you diagnose OCD if you were going to see a specialist? And also, what is the difference between obsessive compulsive disorder and there's also a diagnosis called obsessive compulsive personality disorder. So we're not going to confuse the two, and I am going to make a separate video on that. OCD is listed in the DSM-IV, which I am going to be reading from a little bit today and just using the criteria to help you understand this diagnosis and what might make you fall under an OCD diagnosis. So the first thing to remember is with OCD, it is characterized by the presence of obsessions and compulsions. So an obsession, for example, might be that you're obsessed with being clean. And a compulsion would be that you have to clean your oven a certain amount of times. Another example of a obsession might be that you're obsessed with the idea that your house is going to be broken into or set on fire every time that you leave. So every time you leave your house, you might have the compulsion to check your house a certain number of times, to set an alarm a certain way. So how do we define obsessions and compulsions? Obsessions are the first part of that. So obsessions are defined in the DSM as recurrent and persistent thoughts. They can also be urges or images. And usually people with OCD experience these as intrusive or unwanted, so they don't want to have these obsessions, but they do have them. They cause them to feel very anxious or distressed, and there's a lot of attempt with OCD to suppress these obsessive thoughts and to kind of try and push them down and make them go away. So it's a real struggle for these people who have this diagnosis because they don't want it. What they will do quite often to try and prevent the obsession is then to engage in a behavior that is compulsive. So this compulsive behavior is used in an attempt to hopefully minimize the anxiety and the distress that a person feels when they have OCD and when they're having the obsessions. So compulsions would be defined as repetitive behaviors. Things like hand washing, ordering, checking behaviors, like checking that things are okay a certain amount of times. It can also be mental acts, so things like counting numbers in your head, repeating words. Those are mental acts or compulsions that would be mental. Individuals feel drawn to do compulsions as a way of responding to their obsessions. The behaviors in a compulsion are aimed at reducing a person's anxiety or stress levels. They also are completed in order to prevent a bad situation or the situation that the person with OCD thinks is going to happen. Now, to be labeled with the diagnosis of OCD, the obsessions and compulsions have to take up at least 1 hour of your time each day. They also have to cause some kind of impairment that is obvious in a clinical way. It may cause significant distress, and it might be in your functioning at work, in your relationships, in your personal life, or just other areas that are socially important of functioning. A way that they do this is, so for example, if you have a job and you have OCD, you may find yourself in a struggle there because things take you longer, or you may spend so much time obsessing about how things have to be done a certain way and acting out your compulsions that it really affects your employability or your relationship at work with your boss and with others. OCD has to be organic, so what I mean by that is that it isn't caused, to be diagnosed with OCD, you cannot have OCD that is caused by a substance or by a substance use disorder. So if you have an issue with addiction or you are on a certain medication or those kind of things that are making you have OCD-like behaviors, that would not be necessarily diagnosed as OCD, and that would be an effect of a substance. It also can't be caused by another medical condition or some other kind of disorder like a physical illness. OCD can be linked to other behaviors. So, because of these obsessions and compulsions, especially people with things like eating disorders, with self-harm disorders, who have other anxiety and trauma-related stressors, it can really amp up the symptoms of OCD. Sometimes with eating disorders especially, there can be kind of the obsession with body image and with food, and then the compulsion would be either like something like binging or purging, could be obsessive working out or exercise, or a compulsion to react to the obsession of the body image or the eating disordered issue. The same thing can happen with self-harm. Some people with really severe OCD also don't like certain words. They don't like certain like even numbers or odd numbers. They have to count things obsessively. And there's a big difference between this disorder and OCPD, Obsessive Compulsive Personality Disorder, because people with OCD don't want to have OCD. They don't like having OCD. Whereas with OCPD, people get kind of an enjoyment from the personality disorder, and they don't have so many of these kind of intrusive obsessions and compulsions. They just are very rigid. A diagnosis of OCD isn't hopeless. There are a lot of really great OCD workbooks. The other therapy that is effective with OCD is cognitive behavioral therapy. That's a therapy that I practice in my own work, and I have found to be really effective because it challenges those obsessive thoughts and the reason why the obsessive thoughts lead to a person having to enact a compulsion. So don't feel hopeless if you have OCD or an OCD diagnosis. The other option is medication. But I always recommend, a combination of both of those things can be the answer to overcoming OCD. If you really are engaged in CBT, that will lead to kind of exposure therapy as well. So the purpose of exposure therapy with OCD is to really help you be exposed to uncomfortable sensations, but also in the end realizing that some of your OCD thoughts are irrational and that the risk of harm to you from being anxious is relatively low. So reach out for help. There are also OCD support groups. Other people suffer with this, so don't feel alone in your illness. If you have OCD that's combined with these eating disorders, body dysmorphia disorders, or self-harm, please talk to someone if you are at risk or if you are harming yourself. This video is just a guide to kind of some of those criteria for OCD. I don't encourage self-diagnosis. I do encourage seeing a psychologist, a psychiatrist, or a mental health therapist, someone who is trained in this area and can help you deal with what to do next with this disorder. Thank you so much for watching as usual. Please subscribe to our channel. We're growing and it's awesome. As always, don't hesitate to ask me questions. Thanks so much for watching and have an awesome week.